Hi guys, Dr. Axe here, and excited today to go over your results from the exam, the x-rays, and figure out are we going to be able to help you or not. But first, I want to go over our Axe Holistic Medicine method and really how it works and some of the most common questions that we get. So, three things we're going to hit on real quickly. How do you actually read your results, your x-rays, and what does it mean? Secondly, what are the 5 key elements to our method and how we're able to get great results? And then we're going to go over some common roadblocks that we encounter. So just recapping what we talked about the other day when you first came in, the brain controls everything. That's the reason that we take x-rays, because we want to see how well is the brain able to communicate down through the spinal column and out the nerves and tell your organs how to work. Pain is a sign that this system is not working better. That's not the problem. The problem is there's a spinal issue, there's spinal dysfunction. That's the problem. The symptom is just pain. We want to fix the problem, not just the pain, right? So spinal function equals health. Now, the way that we analyze that spinal function and the way that we figure out how to fix it is really through x-ray by looking. So we're going to go over how to read your x-rays and what each thing actually means. And again, this is why we get so excited at the clinic about pain, because we're not excited about pain, but we're excited about getting you healthy and reaching your optimal goals in life. So let's go over some x-rays. This is a low back one from the front here. You can see on the right hand side, your hips should be level, right? You can see here the right hip is a little bit higher than the left hip. That's one thing you're going to look for on your x-rays. The second thing is from the front to back angle, you should be perfectly straight. On the left here, this is common. It's like a mild scoliosis where it's bending to the left and it's compressing all those nerves on the right. That right hip is higher. So again, we want to be completely straight from the front angle. And then from the side, this one's really big. All your bones should line up, okay? Right here you can see this is called a spondylo. This is instability of the spine where the ligaments have actually been damaged. And we have some special machines at the office and exercises that hardly anyone else offers that actually corrects ligament instability, and we're able to correct 50 to 100% of what you're seeing on the x-ray here. So right here, L4 has actually slipped forward on L5. You can see how L3 lines up perfectly with L4, where this one has slipped forward and now it's sliding forward and it's crushing that nerve right here as it slides forward. So, as the spinal cord goes through, straight like that, as it slips, it literally is crushing the spinal cord and the nerves. That's the first thing we look for. The second thing we're going to look for on your x-ray is that it makes a nice curve, a nice C. We don't want it to be straight, okay? Because if it's straight, that's going to stretch that spinal cord by about 18%. Just like if you make a C with your hand right now, that curve has a lot of strength and structural integrity. But if you open it up like that, you'll feel the skin on your thumb actually stretch. So if you lose that structure in the back or the neck, you're going to stretch that spinal cord. Really, really big deal. But again, through our Axe Holistic Medicine method, we've been able to correct anywhere from 50 to 100% of this. Conventional medicine wants to bolt this thing together, put a plate, and just screw the whole thing together, which is a terrible idea, okay? They call it failed back surgery syndrome because so many people with surgery, it fails, okay? You don't want to start bolting your body together if you don't have to. And 90-some% of the time, we can fix this without surgery, right? We should always try to fix it naturally before we jump to surgery. Let's take a look in the neck here, okay? This is a patient that had a lot of mid-back issues, neck pain, some numbness into their hand, heart palpitations, and a lot of headaches and things like that. And the reason here is you can see the red line is the natural curve that we should have from the side angle, right? From the front, you want to be totally straight, but from the side, you want to have curvatures, okay? That's why they make a dome roof, the super dome, because that roof holds a lot of weight and support. If it was a flat roof, it would cave in the middle from all the pressure. So there's amazing, amazing engineering that goes into into our spine. So on the right hand side, we want to have this natural curvature in here, okay? It's much, much stronger. And you can see when you lose the curve, it closes down the disc spaces and actually compresses the discs, causes herniated discs, bulging discs, and then those discs pressure on the nerve, causing pain and disease. Okay, so from the side view, again, we want a nice curvature there. We want all the joints lined up. And this is someone that went through our treatment, got amazing results, did everything that we asked, which we're about to go over. Headaches went away, neck pain went away. They had more energy, they felt better because their brain was actually able to, without any pressure or irritation, the brain was able to communicate down the spinal cord, out the nerves, and tell their entire body what to do. And again, of course, headaches went away, neck pain went away. But that did take a while because it took about 10 years to develop. So here's even worse x-ray. Now here you can see because the curve has actually reversed and started to go the other way, which is common now because of our culture of sitting, we're in car accidents, we're looking down at our phones all day. It's an epidemic, okay? And because of that, you can see at the very top of the, in the neck, good disc space, but you can see as the weight starts to build, very small squished disc space, tons of degeneration here from that loss of curvature, right? So tons of pressure. And then you'd look at an MRI of it, and you can see here, this is her spinal cord, and these are the discs. And you can see because of that loss of posture, okay, that disc is starting to push and bulge into the spinal cord, right? And this is someone that actually had no pain at all. They were just tired all the time, just had a lot of disease that the doctors couldn't figure out, high blood pressure, high cholesterol. It was just nothing made sense. And we're able to see the brain, right? The white fluid in her brain was not able to flow back and forth from her spine to her brain. So it caused a lot of health issues, okay? Not just pain. So this is just a cool example. If you can see on an x-ray what that actually looks like on an MRI, the disc pushing into the spinal cord. Now, I think about Christopher Reeves in this example where he fell off of his horse. He had one of these bones push into his spinal canal just like this, but a little bit worse, right? It pushed 1 centimeter. This is probably like 4 or 5 centimeters. And he was paralyzed from the neck down. Information was still getting through, but he didn't die of neck pain. He died because his immune system was so weak, because his brain couldn't communicate to his heart, his lungs, and his immune system, right? He had to have a pacemaker so that the nerves, because the nerves didn't fire right to his heart. He had to have people move stuff through his gut because he wasn't digesting, because his nerves in his neck weren't firing and telling his gut what to do. So guys, you have to get this. So important. It's not just pain. Your brain has to communicate with your organs, and it does it first through the neck, then the mid-back, then the low back. So we got to get this corrected, just like Christopher Reeves. He didn't die because of neck pain. He died because of spinal issues and pressing on his spinal cord. Really cool research article showing that if you lose the posture in your neck, right, you have bad posture and then you lose the curvature, that that kyphosis of the cervical spine not only damages the nerves, but causes the nerves to demyelinate. That means the protective shield just deteriorates and degenerates. Your nerves literally deteriorate, and it presses on the blood vessels in the spinal canal, causing it to degenerate even worse. So it's not just you look bad or you have bad posture. No, it's killing the nerves in the spinal cord, right? So there's tons of research on this. And this is what a normal curve, the spinal cord, looks like. And this is what a loss of curvature in your spine, the spinal cord, actually looks like. Last example I want to talk about here is if you don't move it, you lose it. This is someone you can see good on the side view of their neck. Yes, they've lost the posture. The head has come forward. But you can see they have good disc at the top of their neck, but zero disc, a lot of deterioration in the base of their neck. And that's because these joints are starting to fuse together. You can see these little calcium deposits, these little beaks here on the front. That's because they're not moving. And when your body doesn't move, it just fuses things together since it's not moving. So movement is so important, okay, so that your spine doesn't deteriorate. And this is someone, their posture isn't perfect after treatment, but huge difference as far as straight line, starting to get a little bit of a curvature. We're getting mobility in those joints, right? We're getting movement from our treatment, and then those discs are starting to rehydrate and get healthier. So a lot of people say, oh, it's too late, I'm degenerated, we can't reverse it. We can't necessarily 100% reverse it, but we can definitely make it a lot better and turn back time a little bit. Now that you understand how to read your x-rays, I want to talk about the 5 things that we do, the 5 things that cause spinal issues, right? Number 1 is don't be so tight. Move it or lose it. We just talked about you got to get motion in there. Number 3 is how important posture is. 4, inflammation equals pain. Okay, and then the 5th thing, knowledge is power. If you don't change the way that you think and you don't have an understanding, you can do the right things, but if you don't comprehend, it's just not going to last. So let's talk about how posture is important. We showed you on x-ray. Every inch that your head moves forward, it doubles the weight of your head, right? So in this person, their heads move forward 3 inches. Now they have 42 pounds of compression instead of 12 pounds. So forward head posture leads to long-term muscle strains, disc herniations, arthritis, and pinched nerves. So we got to start to work on your posture. And when we're talking about, the muscles, right? Don't be so tight, which was one of our first causations here. So what happens is your postural muscles they're long distance runners, okay? So they're designed to hold your head and hold your body into place. But instead of 12 pounds, head comes forward. Now they're holding 42 pounds. Those muscles are not designed to hold that much weight. So those muscles contract and cause trigger points. They basically knot up in an effort to try to hold your posture up, okay? So basically your phasic muscles are recruited. Phasic muscles are just, if you're bench pressing, you're moving something heavy and you just need to move them for a minute or two. You recruit those phasic muscles because your postural muscles aren't strong enough to hold your poor posture. And those muscles knot up, create trigger points, which create a lot of pain and dysfunction. So the way that we fix that is through upper cross syndrome or lower cross syndrome. So what happens is it makes a cross. So right here, your weak muscles are on the front upper chest, and then lower traps, serratus anterior. And then you make an opposite cross, and then things become very tight. Your pecs, upper traps. So we have to stretch here, strengthen here, strengthen here, okay? And the same thing for the low back. Glutes, butt gets weak, abs get weak, back gets tight, etc. So don't be so tight, guys. And this is exactly how we fix it through physical therapy and looking at your posture, looking at your x-rays. Again, just fixing upper cross syndrome by itself is not enough. You have to hit all 5 elements, which we're talking about right now. If you just try one of these, it's not going to work. We have to put all of it together, okay? The next thing we just talked about is systemic inflammation. This is why you can be in pain, but take a steroid, and now the pain magically goes away because you just cleared out the inflammation. The problem is you didn't fix the problem. However, we need to reset the system and clear the inflammation out because we might fix the problem, but you might still be in pain if we don't clear it out. So we use something called a magnetic MAC, called pulsate electromagnetic frequency. And this is a study showing control group of inflammation. They then took a steroid and it reduced it way down. But people that did PEMF technology, it was 50% as effective at reducing inflammation as a steroid, right? If you could reduce inflammation with no side effects, all it does is increase your circulation, increase cardiovascular health, decrease inflammation naturally. It's a no-brainer. No, it's not as powerful, but there's no side effects. So we use a magnetic technology called pulsate electromagnetic frequency and 0 side effects. So really cool. The second thing that we do to reduce inflammation is if you've wore out that cartilage in your joints or in your spine, it's rubbing and it's being irritated because it's rubbing because you've lost that cartilage. We use your own blood and we concentrate it, called platelet-rich plasma, that actually get that cartilage to heal. Or we use something called prolozone, which is ozone and B vitamins, to get that cartilage and get your spine, get your joints to actually heal themselves. So again, if you want to reduce inflammation naturally, we need to clear it out with magnetic technology, but we also need to regrow that cartilage and that tissue so that you don't have continual irritation. So finishing up here, guys. So again, we kind of talked about the causes here. The tightness, which we fix through upper cross, lower cross syndrome. We talked about how posture is important. We're going to go over some of those solutions. We just talked about inflammation. We got to clear that out. And knowledge is power. So number 5, knowledge is power. We have our dinner with the doc. We have workshops where you come and you get educated. You bring your friends and your family and you get on mission with us to educate our community about what true health is and the steps you have to take. Okay, super important. So let's talk about trigger points a little bit. Let's talk about chiropractic and other ways that we fix posture, and then we'll wrap up. So trigger points, those are those tight, knotted up muscles I told you about. We actually do trigger point injections where we take salt water, basically saline, we go into that muscle and we lubricate it and it releases the whole muscle fiber. Okay, it works a lot better than massage because you're actually lubricating and breaking it up. So just a really quick way, in a couple minutes, we can get in there, release all those tight muscles, because if we don't fix that, we adjust you, we stretch, but that muscle stays in a knot, we're going to be fighting your muscles constantly, never getting anywhere. So super important. And again, we use physical therapy to fix that muscle dysfunction. Chiropractic, we use our hands manually, or our younger, older patients will even use instruments that pulsate 6 times a second, which is quicker than your muscles can react. So we can bypass your muscle system and actually get a movement in that joint. Earlier, where I showed you on your x-ray, it's deteriorated because it's not moving. If you don't move it, you lose it. So through chiropractic instruments, we're actually able to break scar tissue, break adhesions, and get your spine moving again. But again, chiropractic by itself is not enough. We have to put all of this together, but we got to get things moving. The other part to get things moving, we use traction, actually pull things apart, pull hydration into your disc. We use different decompression tables for the neck and the back. Okay, posture is important. We use vibration plate technology. The vibration actually retrains your muscle memory and tells your brain, here's the new posture, shoulders back, head back, right? If we don't tell your brain that, your muscles won't hold on to it. And we also use, it's called a dental roll. It actually molds the curvature back in your spine, because you can strengthen all day, but if you don't mold the ligaments, right, and change the plasticity of it, right, just like braces do, it's not going to hold. So we use different dental rolls to do that. Last thing I want to hit on is roadblocks, okay, that get in people's way. And it really always comes down to money and time. But I believe in investing in your health is way more profitable, way more beneficial than, investing in the stock market. Is it cheaper to maintain your health or wait, right? Is it easier to maintain your car and keep the oil changed, tires rotated so they don't degenerate, right? Or your tires wear out? Or do you just wait until your tire blows up or your engine runs so low and your engine blows up and then you have to replace the whole system? It's way, way cheaper to keep your tires rotated, keep your oil changed. And the same thing is true with your health. So either pay a little bit of money now or end up spending a lot more money in the future trying to fix it. And the same thing with time, right? A lot of people spend the last 20, 30 years of their life in and out of doctors, just spending all their time not even enjoying life because they didn't take the time earlier on to fix their health and feel good, okay? So I guarantee you, putting the time in now is going to save you an exponential amount of time later. You got to do something about it now. The sooner you do, the more money you save, and the more time you'll save in the long run. So next steps, guys, join the mission with us. Tell other people that are sick and suffering and looking for answers. We have an amazing method that I know that works. We have a lot of testimonials to prove it. and get your family members checked. We do a free spinal check because, again, it doesn't make sense to save your own health and learn about this and then let your other family members suffer. We need to just check them for free and see if there's anything going on, and then you make a decision whether they need it or not, okay? And the last thing is education is key, right? You got to change your mind if you're going to change your habits. And that's going to our dinner with the doc. You get meet the staff, get a little bit more educated, and get all your questions answered. So can't wait to work with you guys and see some amazing results.